Can everyone hear me now? Woo! How are we feeling? Let's give a round of applause for a women-led panel. Woo! I love to hear the excitement. So, for this panel, I am particularly excited to be able to announce what women-centered inclusion looks like. Specifically, solving what real-life issues look like for disabled women. Because so often, disabled women in times of crises, it rarely looks neutral. Most often, in times of crises, crises only amplify what is already unequal. For example, when health systems strain or when these services really falter, disabled women really suffer. And it's not because they lack resilience or they're doing anything wrong. It's because these solutions and these systems were not designed for them in mind. For example, it could be maternal and reproductive health care that fails to meet accessibility needs, or domestic violence shelters that don't think about disability or caregiving dependencies for so many disabled women. But most importantly, what I want you to take away is that this session is not about women with disabilities as victims of crises. Instead, this session is about the women that are designing the solutions for them. The women that are shaping inclusive solutions, especially where health, safety, and protection are at most risk. And excitedly, we are featuring Zero Project Awardees of this year that span all across Asia and the Pacific. And today's discussion highlights and discusses innovation that is truly rooted in lived experience in local realities. So whether that's accessible menstrual health services or digital tools that are really addressing gender-based violence and access to support services. Because in moments of crisis, inclusive design can really be the true differentiator between vulnerability and agency. So please join me in welcoming these speakers to the stage and welcoming the next session, Women-Centered Inclusion.
Thank you so much. My mic on? All right, is that on now?
Yes.
Okay. All right, my name is Katherine Johnson. I am from the lovely state of Minnesota, close to Minneapolis, where I'm sure all of you have heard of these last few months. But we are here still with hope, and meeting so many of you has really given me hope for a brighter future working together. I want to start with a personal story before I introduce our panelists here. I was diagnosed with breast cancer in May of 2024. I wasn't able to attend last year, but through my journey, which became a personal life crisis, I realized how challenging it is for women with disabilities to get breast cancer care. And so I want to bring to attention that women with disabilities face significant disparities in breast cancer care, including lower screening rates, later stage diagnosis, and higher mortality compared to women without disabilities. And so I'm asking all of you to be advocates for women with disabilities to ensure proper health care, screening, and treatment are options for women with disabilities. So, and all women. So, and for the men in the audience, you can be advocates too, to ensure that the women that you love in your life are getting the care that they need. So that's my personal testimony to open our session on women and healthcare today. Thank you. I'm happy to be here. So, yeah. All right. So opening this session, we will feature Zero Project Awardees of 2026 from Asia and the Pacific, highlighting how women with disabilities are managing inclusive responses in crisis contexts, from menstrual health initiatives to digital tools, addressing gender-based violence and protection. We have 4 presenters on our stage who are new friends. This is one of the outcomes of the Zero Project. You get to meet new friends, right? Hopefully lifelong friends, all of us, that give me hope. We start with Agnes. I hope I say her last name right. I just learned how to pronounce this. Jokes? Great. She'll say her name correctly. And then we will have Gerda Binder from UNICEF in Spain, and Jane Wilbur from the London School of Hygiene and Tropical Medicine in the United Kingdom, and Abia Akram, who is from the Special Talent Exchange Program in Pakistan. As I introduce each of the presenters, I will share a short bio on each one of them, and then we will have an opportunity for questions and answers at the end of our session. So today, I'm going to pass the clicker. You can do your clicker. Alrighty, may I? Today we are starting with Agnes, who I was really excited to spend some time with yesterday. I'm sure you will enjoy meeting her. Agnes was born with cerebral palsy and uses a wheelchair, supported by a personal assistant, who is here. There she is, thank you, and other services. She graduated in 2019 with degrees in translation studies and Slovenian language and literature, and completed a master's degree in English translation and interpreting with a thesis on metaphor translation. In other words, she's quite smart. And she works as a freelance translator, language editor, journalist, and writer. She is currently a PhD student and lecturer at the University of Maribor. In 2022, she joined the EDF Youth Forum, and in 2023, became a youth representative to the Board of Cerebral Palsy Europe. She now serves as chair of Cerebral Palsy Europe and advocates for disability equality and inclusion. Could you share with us now, Agnes?
So, thank you for having me here. It's really an honor, especially because my presentation today, it's not about a tool or some kind of physically visible solution, but it's mostly about our recognition. I am an advocate for persons with cerebral palsy, especially for women with cerebral palsy, as I'm a woman with cerebral palsy myself. And I think it's important that we start from scratch, because many people, especially professionals, are not aware what cerebral palsy means and what it does and means for people like us, how to approach us, how to act with us, especially in the field of healthcare and other medical procedures. And my focus today is to present a case study that was led by a wonderful woman, a doctor, Somali Shah, who also has a cerebral palsy herself. And she conducted a research on women with cerebral palsy that went through pregnancy, through whole pregnancy journey, and also postpartum period. And let me just make it quick, yeah. Yeah. And this research was funded by the National Health Service, which means it was supported on the national level as well in the UK. And the principal investigator was, as said before, Dr. Shah, and the results were fascinating. So why is it important? Because many women are often neglected when it comes to healthcare services, especially in vulnerable times such as pregnancy. And with research like this, we highlight where there are gaps and benefits and what we could do next to be more inclusive, more friendly, and more understanding. And this is one of the first such case studies in the UK, and it shows a great example for the future for other countries as well. You can move on. So how the research went, 16 women were interviewed, and the questions were centered about their own experience of childbirth, of pregnancy journey, and especially on how professionals perceive them. Whether they saw them as a risk case example or just a number or just as a person with limitation, an alien, so to say, because many people see persons with cerebral palsy as some kind of creatures from the other planet, which is not the case. And they're afraid to approach us even. And so the interviewees were asked about what measures did they take, how they felt, whether they were supported enough or they felt they had to face the challenges alone, and of course how their physical experience was about the procedures, processes, healthcare equipment, doctors' offices, all together. And what we found, or what the researchers have found, is that there is an extreme lack of professional knowledge about CP. Women that were interviewed had diverse types of this CP, and they also had to have at least one experience of pregnancy, also a miscarriage. And also, what the research highlights is that it is important to communicate, both from the side of patients and of doctors. And also, it is important that we point out to the examples of good practice, because they do exist. I read an interview about a woman who was very satisfied with her gynecologist, because all through her pregnancy, she included the presence of her general practitioner and physical therapist. So both aspects were covered, and she felt generally safe and secure, and especially dignified in her condition, because being dignified and respected is what makes the difference. Move on. Of course, this project is not a sole example of such practice. It is important that we include international dissemination of these results, and that we talk about this at the event like this one today, that we make different discussions, different points, and that we make people aware that even in times of crisis, such as pregnancy or other issues and sensitive matters, it is important to stay human and to see a person, a woman, and not a disabled individual. And of course, it is important that we train our professionals so they learn how to treat us correctly. And so, to conclude with my own personal experience, I personally had pretty good experience with healthcare professionals in all the areas, but especially what I stand for in my adulthood is accessible physiotherapy in adulthood. Why? Because in many countries across the world, physiotherapy is not free of charge anymore after we turn the age of 18. And this is some kind of ironic, because cerebral palsy does not disappear when we grow up. And this is important because physiotherapy is one of the channels that can help us to maintain function, that can help us to stay included and be productive in society. For example, if I had not have regular physiotherapy sessions, I wouldn't be able to sit here today and doing my daily tasks. And so this is another project that I've been working on. Together with my physical therapist, we made a case study with my own example of how important it is to have regular physiotherapy and how it impacts social inclusion. The article is still unpublished, but we hope that our results will highlight the fact that it is important to stay physically active, both in terms of sports activity, fitness, and physiotherapy, and to stay included through all the adulthood period. So, thank you very much.
Thank you so much, Agnes. I'm just so proud of her and the work that she's doing as a champion in the disability community. Next on our panel, we have Gerda, who I just met this week also. And Gerda is a UNICEF Senior Advisor with the Digital Impact Division. She works on inclusion, gender equality, and digital technology together with partner organizations, governments, communities, and users, to promote and realize equitable digital transformation and to close the gender digital divide. She supports the creation and scaling of digital solutions, which I'll share about, digital public goods, and digital public infrastructure with, for, and by women with disabilities and marginalized populations around the world. She also works on gender responsive digital literacy, child rights, and safeguarding in digital platforms, including AI, prevention and response to technology-facilitated gender-based violence, women in tech, and in AI governance, and digital disability inclusion. So you can see why I'm excited to hear her presentation. So Gerda, if you could take it from here with your presentation.
Thank you so much. Can I get the clicker? Yep. Okay, super. Well, good morning, and it is a pleasure for me to be here today. Before I begin my presentation about a digital innovation and how it supports girls and women of all abilities to manage menstruation with safety and dignity, I would like to provide a very brief introduction what menstrual health and hygiene is, often also used in the acronym MHH. So menstrual health and hygiene is defined as having access to accurate information about the menstrual cycle, menstruation self-care, and hygiene practices. It also includes effective and affordable menstrual materials and facilities for changing, washing, reusing, and disposing of menstrual materials. It also includes access to medical diagnosis, treatment and care, and pain relief strategies. And lastly, it includes a stigma-free environment. Super. Now, I want to begin my presentation about OKI and its digital disability inclusion approach. OKI is a digital public good. The first version of OKI was co-created by UNICEF with adolescent girls in Indonesia and Mongolia in 2018, so some time back. And at the time, the girls really asked for very specific support, digital support, in form of gamified, fun, and easy to navigate mobile app because they needed it to function fully offline. The girls also determined the look and feel and design of their application and the desired features that meet their wants and needs. And they called the app OKI, which is a fun and completely made-up word. Meanwhile, OKI has been localized with girls and young women in more than 15 countries across the world. More about the inclusive localization process with girls with disabilities and organizations of people with disabilities in the next slides. But first, I would like to share with you a screenshot of the OKI app's main screen and an overview of its main features. So in every new country, OKI gets localized with girls by a local partner. And this always includes girls with disabilities, their caregivers, and through the facilitation of an organization of people with disabilities or maybe a school for special needs. During the localization, girls shape the designs, avatars, backgrounds, features, and content of their local version of OKI. They specifically work to address local myths, stigma, and harmful practices in their context. So for OKI users to distinguish facts from myths, learn about their individual body, and feel positive and empowered. In some countries, for example, in Papua New Guinea, the localization of OKI took place in partnership with a special needs school. The teachers and caregivers We're involved to support girls in shaping their local version to their needs, and then they support them in using Oki once the local version is launched. And the Oki team has also created easy-to-follow guidelines and best practices along the way for local partners to understand how to be inclusive. We summarize the principles of accessibility, how to partner with local organizations of people with disabilities, and ensure that girls with disabilities, as well as boys, are included along the stages of Oki deployment and localization journey. And this toolkit, here you can see a screenshot, was tested and consulted with organizations in the Philippines, Kenya, Tanzania, and Burundi. And it is now applied by all the 15 Oki countries. Oki is compliant with the VCAG 2.1, and both the Android and iOS versions were audited and improvements were made, for example, to contrast, navigation sequence, labels, text alternatives, and error identification. But as highlighted before, girls with disabilities are included in the localization, launch, and promotion of Oki in their country. And many of them have created designs of avatars with disabilities. Oki's evidence-based but girl-friendly and empowering content includes articles in its encyclopedia on how to manage your period with a disability. Oki's inclusive content is continuously updated, expanding based on feedback by girls and users, and our partners across the countries support with new content creation, collect feedback, and provide quality assurance, especially in low-resource languages. So Oki is currently available in more than 22 languages. The Oki app has also been adapted for tablets and computer desktops for girls who may need a larger screen to benefit from Oki. These versions make Oki more accessible for girls, for example, with mobility difficulties, dexterity challenges, or spasticity. Also, girls who might use a tablet attached to their wheelchair, girls with vision impairment, or those who can only access tablet devices or desktop computers, for example, in school labs or in girls' clubs. Meanwhile, we also have low-tech versions of Oki, which were also to always reach the most marginalized and excluded. And before I close, I would like to invite a user herself to speak to you. Do I have to click again?
Nope.
My name is Rose Sure. I live in Kibra, Nairobi. Through LVCT Health that invited us persons with disability to get in the application we're making. Yes, the app has avatars that show, for example, the hearing aid, which means deaf, also other symbols that also involves blind. Yes, my ideas were included. Yes, I use it. It's easy. It's easy to navigate, and yes, it's useful. I may not be familiar with my menstrual cycle and the dates, but Oki helps. It's easy for us deaf to use as well.
Thank you. So to wrap us up, on Oki, we continuously document and publish all the evidence and our learnings as toolkits, and our aim is really to support others in developing inclusive digital platforms, especially inclusive for girls and women, and working with organizations of persons with disabilities in the design, in the iteration of digital solutions and also investing in their digital skills education. Thank you.
All right, amazing work being done, and it's just awesome to see that UNICEF is supporting so much advocacy in the disability community also. Next, we will have Jane Wilbur. Dr. Jane Wilbur is an assistant professor at the International Center for Evidence in Disability at the London School of Hygiene and Tropical Medicine. Jane's research focuses on disability, menstrual health, water, sanitation, and hygiene. Jane has worked in East and Southern Africa, South Asia, and the Pacific Islands. She has extensive experience in researching, designing, implementing, and evaluating inclusive menstrual health and WASH, W-A-S-H, programs in development and humanitarian settings. She has extensive experience in disability and health political analysis and in translating research into policy and practice impact. Jane is also part of an awardee, or is an awardee of 2026 Zero Project, focused on menstrual health support for women and girls with intellectual disabilities, which she will share more about with us right now. Thank you.
Thank you very much. Oops. So I'm talking about the Vienna campaign. This is a collaborative study between the London School of Hygiene and Tropical Medicine, one of the world's leading public health universities, and World Vision, a global humanitarian relief and development organization. It was funded by ELRA, and my colleague Elise Lee from World Vision Vanuatu should have been here, but she didn't get a visa, so I'm representing her as well today. So, stigma related to menstruation and disability intersects, leading to poorer menstrual health outcomes for women and girls with disabilities. So, for example, people with disabilities are 20% less likely to know about menstruation at menarche, and nearly twice as likely to miss out on social activities. And globally, an estimated 26 million displaced women and girls are menstruating. And there's an increasing recognition that menstrual health is a critical component of humanitarian responses. But people with disabilities, and particularly those with intellectual disabilities, are often excluded or rarely considered in these responses. So our study was conducted in Vanuatu, which is a Pacific island nation of over 80 islands, 65 of which are inhabited. So it's a really small population, but widely dispersed, very hard to reach areas, and transport options, particularly to the northern provinces, are intermittent and very expensive. The country's prone to seismic volcanic activity, cyclones, extreme weather events, drought, sea level rise, and the government is committed to enhancing climate resilience and adaptive capacity. So the Vienna campaign. This is a menstrual health intervention for women and girls with intellectual disabilities and their caregivers in Vanuatu's humanitarian responses. It was adapted from the Bicester campaign, which I developed with WaterAid and delivered in the Nepal development setting. The Vienna campaign is about supporting understanding about how to manage menstruation with dignity and hygienically before, during, and after a humanitarian emergency. Importantly, we supported male and female caregivers to understand how to manage a young person with intellectual disabilities menstruation. And the campaign focuses on two characters. Vienna, who's a young person with intellectual disability who's learning to manage menstruation as independently as possible, and her carer, Voto Vienna. So the image on the slide, there's Vienna on the left. She's walking forward to the foreground. She has her arms raised. She's smiling, she looks confident, and she's wearing purple and yellow, which are the campaign colors. Voto Vienna is behind her, standing, smiling, looking proud. She has her hands on her hips. It's a behavior change campaign, so it's designed to improve menstrual health behaviors, and this includes things like wearing and changing a menstrual material in private. Caregivers support people with disabilities to achieve these behaviours. Now, this was an evidence-based intervention, so we started off by doing formative research to understand the current situation and what current behaviours are around menstrual health, what's driving those behaviours, what the barriers are, to be able to understand how to trigger more positive behaviours. I'll explain what I mean by that next. So the campaign participants are given period packs to make the behaviours easy to adopt. And period packs include reusable menstrual materials, a storage bag for the young person so they always know where they can get clean menstrual materials. It's always put in the same place. A bin to dispose of the used menstrual materials for washing, and a small bag to take clean menstrual materials out if the young person is leaving home. And caregivers help maintain the supplies, so they keep the bags full, and they remind participants of where they are, how to use them, and what menstruation is. The period packs also include a visual story showing Vevanoa menstruating for the first time, and Voto Hevanoa and her father showing how to wear a menstrual material, where to store it, and that menstruation is a normal part of growing up. It also includes the family evacuating during a cyclone and Vevanoa leaving the home with her period pack. And these stories reinforce the key behaviours around how to use the period packs. And the images on the slides are a selection of those from the visual story. So the facilitation team included Ni Vanuatu women with and without disabilities, and the campaign was delivered through 2 sessions, either through at the household level or in groups. And participants were encouraged to learn by doing. So to demonstrate how to use period pack contents, we had a large Vevanoa doll. And the doll, which is on the slide, image on the side, she's wearing the purple dress, which is the same as all the other images of Vevanoa. She has removable clothes and underwear and a miniature period pack contents. So during the facilitation sessions, the young people practiced changing the doll's menstrual material, disposing of it and redressing her. And the young people also got a small doll, so they could practice changing the small doll's menstrual material when they themselves weren't menstruating to reinforce the behaviours. Now, the dolls were made by women with disabilities in Vanuatu as well. And we used visual cues for each key behaviour and role plays. So I'm going to give a couple of key highlights from the evaluation findings. So the Vevanoa campaign was the first intervention globally to include people with intellectual disabilities in menstrual health interventions for humanitarian emergencies. Now, it was a really good testing ground because there were 2 Category 5 cyclones during the pilot and also COVID. And the evaluation results found that the campaign was feasible and acceptable for the young people, the caregivers, facilitators, and practitioners or service providers. And we saw improvements across all behaviours, all key target behaviours. And many young people were managing menstruation more independently after the campaign. And I'm going to read a quote from a female caregiver. And she said, "The last month was the first time we slept and she went to the toilet and saw her period and took her towel and went to bathe. I saw a big change in her. It was the first time ever. It's helping her now." And male and female caregivers reported being better able to support the person's menstrual health. They said that they're better prepared for the emergency, for the next emergency. And humanitarian actors wanted to scale up the campaign. So I'm going to finish off with a quote from a male caregiver. And he said, "I learnt many things that I had never learned, that I never knew. And it's helped me. If sometimes her mother's not there, I can." So what next? So it's been scaled up. The Vevanoa campaign has been scaled up in 3 provinces in Vanuatu, but now it needs to be adapted and piloted and evaluated in another humanitarian setting. And for maximum benefit, the campaign should be delivered before, during, and after an emergency so that the target behaviours are more likely to become the norm. Honestly, it has huge potential to improve menstrual health for women and girls with intellectual disabilities in many, many more settings. If you'd like any more information, please email me, my colleague Elise, or Christy Urick, who works for World Vision America. If you want a sort of quite light report that gives an overview of the Bechester campaign and the Vienna campaign, please scan that QR code. Thank you very much.
Thank you so much, Jane. I applaud the work that you are doing. Thank you. It's making a difference, no doubt, for young women. Next, we have our finalist, our final speaker. Her name is Abia. She has a personal experience with physical disability herself. She has been engaged in the activities of the disability movement since 1997. She is one of the 100 BBC Women 2021 and the member of the Council on the Rights of Persons with Disabilities, Ministry of Human Rights. In the struggle of giving voice to women with disabilities, she has been lobbying with parliamentarians, UN high-level representatives, focus on developing advocacy strategies to raise awareness, network, and build capacity at the UN level in relationship to the UN Convention on the Rights of Persons with Disabilities and Inclusive Development. She is instrumental in the development and implementation of other legislation also, such as the Disability Rights Act 2020 and the UN Convention on the Rights of Persons with Disabilities. She is known as one of the most active women with disabilities as a leader globally. Her significant contribution for Pakistan's first ever legislation to protect the rights of persons with disabilities has been acknowledged and recognized by the government of Pakistan. So we're honored to have you here today. Please, if you could share.
Thank you. Thank you so much, Catherine. And it's really honor to be part of this very important panel today. I am wearing the blue jacket and the black dress, and I'm on the power wheelchair with an extra speed in it, so can go very fast. And I want everyone to have a big round of applause for the Zero Project Conference, because that have given us real platform to contribute. For me, like today, I'm sharing the story of millions of women and girls with disability around the globe who are facing discrimination, challenges, barriers, and if we go into the disaster-prone areas, those women and girls with disabilities are facing a lot of challenges, and they are the ones who are the resilient, who are survivors, who are fighting for their rights. And we always say, the women united will never be defeated. And that was the point when we started working on this technology-facilitated Noor AI. It's the first ever chatbot in the Asia Pacific to talk about the inclusion of women and girls with disability. We have seen like more than 1 million like women and girls with disability in all the areas. They were facing a lot of challenges, but we also witnessed during the disaster response from the global south that their mothers pray that our daughters die before we die, because there is no support system available. If they are facing the gender-based violence or the sexual harassment, they were not giving the services, the access to the basic services of the health, education, employment. And we also seen those women and girls with disabilities were struggling to report those cases because of the stigma, stereotypes. They were not encouraged to talk about sexual health or the gender-based violence, because it's unfortunately by the people who are supporting them, the family members of those women and girls with disability. And they were really scared to report it. And even if they report it, the challenge was the services were not accessible and it was not responsive. we reached out to the helplines, we reached out to the police station, crisis center, all these basic services, and there was no access for the physical disabled women to go to the toilet. So they stopped drinking water to go to the police station to report it. Then for the visually impaired, for the physical, for intellectual disability, when they went to the health sector, the only recommendation they received was to have the forced sterilization, because that's the solution. And they said, like, no, we don't have any other option for women and girls with disability because their parents are the domestic workers. So those were the challenges which we really thought like it's important. And in the humanitarian response also, they find it difficult to access to the shelter or those services. When they started advocating for their rights, it was like all the organizations not even getting the space in the gender movement or not getting the space in the disability movement. So that was the point when we started working on this chatbot, and it is like not taking replacement of the human aspect of the persons who are supporting, providing the psychosocial support to those survivors with disability, but this is the first-hand services we can provide to those women with disabilities who are confined at their homes. So they have this information that how to access, what kind of services they can get, how to respond to the immediate response on the GBV. And also we translated and connected this this chatbot with the National Disaster Management Authorities. So they have early warning systems, like sending out the notification, and at that time, all the people will translate that through the chatbot and the mobile application that translated in the easy to understand languages for the sign language, for blind people, the speech to text, and also for intellectual disabilities in a very easy, descriptive way so people can access that quickly. And the flow was like not easy because the sign language have like a lot of versions. So we were using the Pakistani sign language. That's have another debate, like how we could sensitize the government, how we can sensitize the tech companies to use the right sign languages, and how we could use that in our chatbot, and that information can be translated in a different systems. The impact of that tech, like new AI, was so huge that women with disabilities were feeling so confident that they have a safe space to talk about their inclusion. They have a safe space to experience the lived experiences of those women with disabilities who are survivors, who are getting that information. And secondly, we trained all the humanitarian response workers through that mobile application and the chatbot, so they can access those services, they can understand. So it was like first time they were talking about that. We also run some of the campaigns with site savers, with UNFPA, with all the UN ODC, like how important it is to talk about this in the social media, in the general public, about raising the concerns about women and girls with disability. It's nothing to worry about disability. It's just a different lifestyle that all we have to accept that. I always ask one question, like how many of you use the wheelchair? If anyone can raise the hand, if anyone used the wheelchair. I think I'll ask how many of you come here on the car, which has the chair and the wheels. So everyone uses the wheelchair, but you park your wheelchair outside and I need my wheelchair inside. So it's just accommodating and making our societies more inclusive according to the needs of those women and girls with disability. And through these trainings, they really understand what is the perspective. So this was on one hand, we were talking about the awareness raising, advocacy, and all. But on the other hand, we are talking about the inclusive policies and the systematic changes that we need. We are talking about the UN Convention on the Rights of Persons with Disability. We are talking about the Sustainable Development Goals implementation, only 5 years remaining, and we're still like struggling. So this is the platform where we can connect with each other, and this is the inclusive platform where we thought like it's important to talk about those rights, lived experiences of survivors with disability, but at the same time, how we can connect it with the mainstream organizations, with the tech companies, with the stakeholders, so they can take that forward. And these initiatives have really given us the opportunity to talk more about the technology facilitated GBV, how we can address that, because these technologies need to have the safe spaces, as my fellow colleague have already mentioned, like using the local interventions, engaging the local voices. When we say nothing about us without us, it means like nothing without us. So it's not only the things which relate to us, but everyone, everything needs to be inclusive and responsive to those women and girls with disability. And I'll again say like this could be replicated in the local context. We need to talk more about creating that referral mechanisms, how different countries' contexts can adopt that, and how we can scale up. And Zero Project Conference have very important role in it, because we are having so many amazing leaders, women with disability. So we need to create that platform together. So thank you so much. Thank you.
And I also forgot to note that she is also an awardee for the Zero Project Award on inclusive and AI-powered chatbot supporting female victims of gender-based violence. So congratulations on that also. So we have 7 minutes and 11 seconds left for our panel, and we wanted to open it up for questions that any of you may have. Is there anyone that may have a question? Please, could you come forward? You have a mic.
Hi, thank you for, before I ask my question, which I think is for Goethe specifically, I wanted to say thank you to all of you for all your work and for all the women out there who are receiving your support. Goethe, I wanted to ask, how long does it take to localize a version of the app, and what are your plans for rollout to other countries?
Thank you so much. I'm trying to read this. My vision is not very good, but we have seen different time periods. Our best guess was localize. Now that you have the code and you have a global app and you have others, you learn a lot from what exists. 4 months, but up to 18 months, depending on how local partners wish to travel across the country. We actually have one Oki partner here from Tanzania, Deborah, a shout out to you. I think Tanzania localized during COVID, during 2022. It took you 6 months? Yeah. And the second part of the question, can you help me with that?
What other countries were you looking at rolling the app in the next few months? If you could share, or if you can't share, that's okay as well.
Yes, so we have the newest 3 countries that joined about 2 months ago and are in localization process, and that is Cote d'Ivoire, Madagascar, and Zambia. But we have a list of 25 countries that wish to localize Oki. So we are looking for resource support to them, to partners that can actually take it on and lead it, because we as UNICEF are only supporting, but we're not implementing directly. It's our wonderful Oki partners. Thank you.
Thank you. A question in the back, please.
Okay, good morning. My name is Hui from Zero Project Europe, and the question I want to put to Agnes and to all of you is what we need to do to give more acknowledgement for medicine classes. What I feel is that some doctors do not know anything about cerebral palsy or about disabilities in general. So the question is what we need to do to give more acknowledgement about that. Thank you.
Thank you for your question. Agnes?
So as I said before, education is the key, but not only having workshops or, I don't know, specific trainings or any other kind of event or seminars, but I think it's also important that we are the ones who open up ourselves and talk about our disability. I know this is hard for many of us, but if we do have an open approach and we are open-minded, we can introduce ourselves to different professionals in different fields. And as I mentioned, my study with my physical therapist, I know I'm one of the lucky ones to have an expert on my side and to have the chance to work with an expert that is open to dialogue. So we both, I listen to him and he also listens to me. And I think that this kind of collaboration makes a difference. So we have to be open on both sides.
Thank you, Agnes. Thank you. Any other questions? Please. One of our young students from the University of Washington.
Hello. My colleague Ella and I researched access to humanitarian aid for older women specifically that are facing or experiencing a humanitarian crisis or facing displacement. And in this project, we used older age as our organizing factor, but recognized that this includes mobility, hearing, and vision impairments. So I wanted to ask, because in our research, we used gender-based violence as a focus area, and we studied that extensively. And I wanted to ask if in your data and work regarding gender-based violence, if older women with disabilities was a population that appeared just as a factor when collecting data. And I'm curious because our research team wasn't able to find extensive data in a lot of the work that we did, specifically in older women experiencing humanitarian emergencies and experiencing gender-based violence at the same time. So I'm always curious to ask how this factor kind of appears in the important research and work that you all do. Thank you.
Thank you. Thank you for your question. We have the Aging Disability Diversity Task Force that we established under the UN. So they are like UN agencies working under the protection cluster, and we have organizations of persons with disability part of that platform, and that have really included the diversified intersectionality of those women and girls with disability. So for example, the older woman with disability, intellectual disabled, and also transgender women with disabilities also included in that. So it was really challenging to collect the data because obviously data is a real gap for all the global south, that countries are not coming up with the exact data, but we have reported that survivors of GBV, older women, and we used the Washington set of group of questions to identify that gaps, and it's really helping us to identify that and be connecting with the HelpAge and the organizations who are working for the older women, but also connecting with the other service providers as well. So this would be really helpful to get those connections with those women and girls with disability who are older women. Yeah, thank you.
Thank you so much, and thank you for your question also. So it's an honor for me to sit on this platform with these four amazing women. I think one of the areas that we really want to emphasize that contributed to this is their passion and their commitment to what they are doing. And so I welcome you to follow up with them, make some connections, and learn from them because their work is amazing, all four of you. Thank you so much. Thank you for joining us.